Hi, I'm Dr. Professor Alex Rhema Zachariah, MD, a retired medical oncologist originally from India, now settled in Urbana, Illinois. And I was trained as a medical oncologist in Indianapolis and as an Eli Lilly clinical fellow. Went back to India and started medical oncology work in North India, pioneering work. Now, both my wife and I, we physicians, retired, now settled in Urbana. We are here with us again, the team of American Cancer Society volunteer Cathy and cancer survivor, very healthy, vibrant, radiant cancer survivor, Trish. Yes, today our topic is the impact of cancer diagnosis on the individual and the friends and family. Yes. Go ahead.
Oh, I guess maybe the start of this will be to ask Trisha, how did the diagnosis impact you?
I had went through a lot of testing. I actually had had several not so good mammograms, had had some biopsies, had had some markers in place. So I kind of always felt like I was just waiting for the other shoe to drop. They had all come out benign. And then I finally went for my yearly. Everything was fine in November. I started playing with my grandkids on the floor in June of the following year. Felt a lump. Immediately called the doctor. Went in for some more and more tests. Then I got the call from the doctor. And I learned really quick that when you get the phone call from the doctor himself, that's not necessarily a good thing. So he said, you know, it's not good. We found cancer cells. You need to make an appointment. You need to get in here. We need to take care of this. The first thought after I hung up that phone was, oh my God, how am I going to tell my husband this? My husband had been through this before. His second wife passed away from cancer. I could not wrap my head around how I was going to go home and tell him, honey, you have to go through this again. She had a different type of cancer than what I was diagnosed with. But just hear him over the years talk about what he had went through with her, I didn't even think about myself and what the journey that I was going to take. All I could think about was, how am I ever going to ask this man to go through this with me? I got home that day. I don't really remember even driving home.
Oh, yeah.
I don't. I just remember pulling up. He was outside mowing the front yard, and I remember getting out of the car, and the minute I laid eyes on him, the tears just flowed. And he shut off the mower, and he come over, and I don't know if he just sensed it or what, but he just gave me a big hug and said, it'll be okay. We can do this together. And so we went in the house, and we sat down, and we kind of talked about it and tried to wrap our heads around it. Well, we still had one child in the house that we had to tell, plus all of my kids that, you know, had moved out and had families of their own, that their mom had a long, difficult journey ahead of her that she was going to have to take. And my husband just kept telling me, you're strong. You're probably the strongest-willed person I've ever met in my life. And I am. I'm one of those people that don't tell me I can't do something, because I'm going to do it just to show you that I can. And but I had no idea what I was getting into.
Yes.
It was by far the toughest, most difficult thing I have ever done in my entire life. I wouldn't wish it on my worst enemy.
Yes.
It's from the surgery that was supposed to last 8 hours that ended up lasting 13.
Oh, goodness.
To the recovery period, no sooner starting to heal and get better than it's time you get your port put in. And then there's another surgery. And then I literally got my port put in one day, and I started chemotherapy the next day.
Wow.
So, and the further I got into treatment with chemotherapy, you know, they get worse and harder, and you get more sick the farther you get into it and the more you do. And so I remember when I came home from the hospital that my husband had to help me shower. I mean, literally, he had to help me walk into the bathroom. He had to basically undress me. And we had a stool in the shower that I sat on, and I mean, it took all I could do just to get into that shower and sit on that stool. And I literally just sat there and let the water hit me, and he did everything. And I got out, and I just remember sitting on the edge of the toilet, and he was drying my legs. And as I'm looking down at myself, I have scars. I have tubes hanging out of me. I had lost some weight. So I was, you know, I literally lost like 30, 35 pounds. And I just remember sitting there thinking, oh my God, I'm a freak. I have all this. What happened to me? Where did I go? You know, it was devastating to me. You know, and I hadn't even got to the part where I'd lost my hair yet and my eyebrows and all that. I just sat there thinking, how am I ever going to get through this? You know, and he was just a rock. I never thought about what he was going through.
Yes.
And the emotions that, you know, I was so worried about him in the beginning. How was I going to tell him?
Right.
Yes.
But then when it got to the point where we were like in the ditches,
Yes.
Right.
you know, we were fighting this, you know, and he was right there with me. And then all of a sudden I'm thinking, oh my, look at me, and never thought about the emotional and mental impact that it was having on him at that time.
Yes.
You know,
Because you couldn't.
And, yeah. Oh, I
You
think it would have just broke my
couldn't.
heart even more.
Exactly. You had to be strong so that you could get through.
Yeah, and I really think I was just had to focus, and, you know, and then as time went on, you know, and eventually, you know, you get 2 tubes out, you get 4
Right.
tubes out, you know, the bandages start coming off, the scars start healing, and then you get told that, oh, there's another surgery here. You have to finish up your plastic surgery.
Oh, goodness.
You know?
Yeah.
So then it's like, oh my, another surgery? You can't stop now.
Yeah,
You're kind of only half baked.
that's right. It must go on.
So, you know, so you're back in and you're now talking to surgeons again, and they're telling you stuff again that you really don't understand, you know, and you're trying to ask all the questions that you think you should ask, but you really don't have a clue, so you're not really sure what to ask. So you just kind of go ahead and go through with it, and again, you get home, and it's more scarring, more bandaging, a couple of more tubes,
Yeah.
you know, and you just keep going. And through this whole thing, like you said, I think I was so focused on having to be strong for me to get through that I really didn't stop. I knew he was there for me. I knew he was my partner through thick and thin. I knew he was taking care of me, but I really had no clue what a huge emotional and mental strain it was actually putting on him. You know, he never said a word. He never looked at me funny. He never complained. He just did it.
Yeah.
He was there, the
You know?
whole of you,
Yes.
all the time to you.
Yes. And then, like I said, so we get through all this, you know, and I remember getting up Christmas morning, not this last Christmas, but the Christmas before, and I got up, felt fine, got dressed, went downstairs, threw up, got my coat on, and went out the door and went to Christmas. You know, and that's just kind of how it was at that time. You know, I was still going through treatment at that time, you know, And it was. I would go to work. I would be fine all day at work. I would come home. I would be very tired. I would sit down in the chair. Jack and I would start to talk. And all of a sudden, boom, in the bathroom I'd go, be sick of my stomach, back out, and fine. You know, it's just a disease that it just messes with your mind big time. One thing I decided, though, or had to come to terms with,
Yes.
is that the old Trish was gone. Cancer took her.
Yes.
She's no more. I had to figure out what the new me was and how I was going to deal with that new me. Before this happened, I was an avid workout person. I was in the gym probably 4 to 5 days out of every single week. I ran on the treadmill. I did cardio. I did, core workouts. I mean, hard, big time, Then I went a year and a half where I did nothing. I could not do anything. It was just, those muscles all go so fast.
Oh, yeah.
And I wanted that back. I wanted to be that fit person.
Yes.
Fit
and active.
I have now, after, about a year and a half, I'm back in the gym.
Yes.
I don't run as long as I used to. I walk faster, but I don't run necessarily.
Right.
I've not been able to do sit-ups yet, but I'm working on it. I'm working on it.
There you go.
There
you go.
I can do maybe 1 or 2, but then it's those muscles where I had the reconstruction surgery, those under muscles or whatever you call them, they're just not strong enough yet to really do that. So I do some leg lifts.
There you go.
And I do some, you
find
other
something else.
We adapt, and I can do some sit-ups using the ball, or whatever. So anyway, so I'm back on track on that. And I guess I just thought that everything kind of was getting back on track. And my husband and I were sitting down Friday night, and we were talking about, our little segments and some things that were going on and some things that we've kind of been talking about to get going. And he hit me with, I'm still really dealing with a lot of this emotionally and mentally. And I'm like, what?
Because you've already put it in place.
I have. I found the new me.
Right.
And I'm dealing with what she is.
Right.
And I've let go of that person. If cancer wanted her, it can have her. I've now got this.
Yeah. I've come out the other side.
I have. And this is now me. And I was just kind of taken aback. What?
Yeah.
And then he shared with me a little bit about, what he's still trying to wrap his head around. Taking this vibrant, strong, very strong-willed person and seeing her wiped out to the point that he never thought he would see me wiped out. He didn't think anything could beat me down like that had beat me down.
Yes.
But again, you go ahead and you beat me down, but I'm coming back.
Yeah.
And it was kind of a little difficult to hear him say those words to me. And it was really an eye-opener to me going, oh my, I need to really open my eyes and pay attention here because I'm not now taking care of him. He's done all this for me, traveled all this way with me, gone through hell and back with me.
Yes.
And now I need to turn around and I need to be there emotionally and mentally for him and tell him it's okay.
It's okay.
I'm here, I'm better, I'm okay. So
that's extremely important for him.
Yes.
To continue the journey with you, and that's so wonderful. It's to have a partner.
Yeah, he's an amazing man, and not just him. I've heard other stories from other survivors and other caregivers, like main caregivers. You have a lot of people that care for you, and like I've always talked about all these angels that came out for me. I'm talking about a main caretaker that's there day in and day out, no matter what. The impact that it actually has on them.
Yes.
They truly travel that journey and every step of it with you.
With you.
And I just want to make sure that people are aware of that. That I definitely, for me, didn't realize it impacted him as deeply as it did. I mean, I know he loves me. I know he was there. I know he was more than willing to care for me. But it really rocked him.
Well, and especially as a second time through this.
Yes.
He had the bad experience of not surviving. Yeah. So for him, he couldn't focus on that. I'm sure he had to focus on you because in his case, it had to have a different outcome.
Yeah. I was bound to determine it was going to have a different outcome.
That's right.
If I had anything to say whatsoever about it, it was going to have a different outcome.
That's right.
So that's kind of a little bit of, my journey and kind of how it affected. My mom, actually, I think I might have mentioned this before, is a 35-year. She's had cancer 3 or 4 different times. I kind of almost lose count.
Yeah.
But she, I don't know, I guess maybe I get some inner strength from her.
There you go. Well, we take it where we can get it.
Yeah.
And my journey was so much different. My diagnosis was almost 15 years ago, and I was having other problems. I was having endometriosis, and I had had 4 or 5 surgeries for that, to treat that. So when the doctor told me we now have malignant cells, and she said, we're going to have to do a hysterectomy right away. For me, it was a relief, like, oh, thank God, there's the end of this journey. So for me, 8 years of surgery after surgery to treat, for me became, oh, thank goodness, it's going to be the end of that. So for me, it was the light at the end of the tunnel versus the beginning of
a horrible journey.
Yeah, the beginning of your journey, or the beginning.
Did your horrible journey first,
I did my horrible journey first, and that was the end for me. So my journey through completely different, which is what we need to let people know, is that not everybody's journey is the same.
So that brings in that particular aspect, because you had several surgeries for endometriosis. They could diagnose it early.
Yes, I was diagnosed very early.
Very early.
Very early, so I was the lucky one.
Yes.
My treatment entailed surgery.
Yes.
Some hormone replacement, but that was soon ruled out. I had radiation, but I took oral chemo. I did not take intravenous chemo. And it was very short-lived. It was just kind of as a precaution because of the other situations. So I didn't have the horrible journey that she had. Like she said, my journey was before.
Yes.
So once I got my diagnosis, for me, it really was the end of the journey, not the beginning of the journey. So, people really do need to understand that everybody's journey is different, and it's okay.
It's okay.
It's okay to be different.
Now, Trish, back to you. This horrendous experience you went through, I liked what you said. It's a new you.
Yes.
And not only to yourself, but to your husband, to your family, and to your friends.
Yes.
And did the whole experience bring out a better you?
Yes.
A stronger?
Yes. Yeah. Well, like I said, I was pretty strong-willed before.
Yes, but stronger.
But stronger. And what I've done now is I would like to think that it's made me a better person. I mean, I always would like to think that I cared about people before and that I was a compassionate person.
Yes.
Now, I'm not only that, but I want to give back.
Yes.
All these people that came out and, again, supported me, from my work family to, I have one of my very best friends at work. She was such an ungiving person. She came out and brought dinner to my house every single week that I was off work. She called me and said, "What are you going to do for Christmas?" And I said, "I just can't. I can't do anything." She goes, "Oh no, you will have a tree." She came out and put my tree up for me and decorated my house a little bit. And then she came back and put it all away.
Nice.
You know, and
Very nice.
Yeah, and she's got like a 30-minute drive from her house one way to my house. You know, she came out in the spring and cut all my floral, you know, all my plants outside for me. She trimmed them all back for me because she knew I couldn't do it. I mean, never asked for a thing. Never said, I never had to ask her. She was just there.
I think
You know?
when you get the diagnosis, it impacts everyone, obviously, around you.
Yes.
But I think it makes people stop and think, what if it were me? How can I give?
Yes.
And how can I make a difference?
Yeah. And, you know, and that's what it did to me. Like I said, I would like to think that I was a caring, kind of compassionate person before, but now I do. I want to give back. I saw how selfless so many people were. You know, I want to do that. And that's why I fundraise. And that's why I want to get involved with different programs. And that's why I want to do, you know, whatever I can do maybe to make somebody else's life a little easier, or whether it's just saying something that comforts them, or, you know, can I bring you a casserole? Or,
Right.
you know, can I come cut your plants back?
Right.
I mean, just anything that I can do, you know, carry your makeup bag.
Yeah, that's right. That's right.
You know, for your Look Good, Feel Better programs. You know, I just want to be able to give back even just a small portion of what I felt was given to me. I just am very compassionate about that.
So that's what I meant, stronger. I certainly want you to get those muscles back. So
We will see those pythons.
Yes. But
I don't know about the muscles, but I could do without this.
but the stronger, compassionate, caring.
Yes.
And so that's what I meant by
Yeah, and I really do think it's brought that out in me.
Yes. And what is
Well,
your thought on that?
I think it is one of the reasons that I got involved with the American Cancer Society, to help people go through the journey. Just because I had an easy journey, I recognized with enough of my clients that the journey isn't easy for everybody. So for me, it was, this disease is affecting so many people. What can I do to make even a small person, small me person, make a difference?
Yes, make a difference.
So it's about making a difference. And the numbers are growing of people that are affected.
Yes.
We need to
And that's
make
so
a difference.
Yes.
We need to make a difference.
And it's young people, older people.
Oh, it
I
just-
mean,
it
is
has-
like across the board.
Yeah, it does not know age.
No.
This disease does not know age.
And also, when the impact of diagnosis, would you like to tell those who are viewing, if anyone ever had that, always remember there is a light at the end of the tunnel.
Yes. Yeah. Well, when I first heard those words, you know, when I picked up that phone and he said, you know, this is Dr. and this is terrible. I don't even remember his name.
Yes.
Isn't that bad? You know, well, it wasn't my primary care physician
yes.
because I couldn't get into him. I had to get into another doctor, you know, and he says, you know, this isn't good. You have cancer. The first thing I just went, you know, and all of a sudden you just kind of see black in your head because it's like, oh no, somebody just pulled that curtain down. You know, and then as you start going through it, you start seeing this little small light at the end of the tunnel that just kind of grows and grows and grows. And then you get to that point where you're just like, well, I can do this.
I can do this.
I can do this. I can get through this. I'm going to take these steps. That light's going to get bigger and bigger and bigger. I'm going to get stronger and stronger. And again, you know, a year and a half ago, if you'd have told me that I'd be back in the gym today, even doing what I'm doing, I'd have said, that ain't happening.
Yeah,
that ain't happening. But I am.
You are.
You know, I feel good. Actually, I am going to do the 5K in the Christie, Illinois Marathon this year.
Good for you.
I am. That is my goal right now.
Yes.
And I think that's another good thing. No matter how small or how big, set yourself a goal.
Yes.
You know, and if you don't achieve it all the way, revamp it and go for it again. You know, that keeps you focused. It gives your mind something to think about. It gives you something to work towards. Set it and do it.
Cathy, some
Perfect.
closing words?
I guess I just think that if you get the diagnosis, whether it's the beginning of your journey or the end of your journey. Know there are people out there for you. It will impact you immediately. It may not impact everybody at the same time. So just remember, there are people there for you. I cannot say it enough times. Call the American Cancer Society. There are people there. There is an 800 number. There's somebody there around the clock. So at 2 o'clock in the morning, when you can't sleep, there's somebody you can call. Please call. Call the local office. You know, just reach out because there are people there that want to make the transition for you easier.
Thank you. And thank you for being with us to go through this journey of getting a glimpse at what is the impact of cancer diagnosis right from the personal experience of Trish and Cathy. Thank you.